Good morning and welcome to Medicare Made Simple with Medicare Myriam. Medicare Made Simple is brought to you by United Insurance Experts. Call today 561-464-CARE. That's 561-464-CARE. Now here's Medicare Myriam.
Thank you for tuning in. I'm your host, Myriam Leyva with United Insurance Experts. United Insurance Experts is not affiliated with or endorsed by the government or the federal Medicare program. We do not offer every plan available in your area. Currently in Palm Beach County, we represent 10 organizations which offer 49 products. Please contact Medicare at 1-800-MEDICARE, or you can look them up online, medicare.gov, to get information on all of your options. The purpose of this show is to educate you on Medicare and to connect you with valuable resources. So good morning, everyone. I hope everyone's having a lovely Saturday, because I sure am. I love Saturdays. I enjoy the weekend because I get to spend it with my little ones. But today we're going to be discussing long-term care from a different perspective with a special guest, Dionne Kellier from Caring Nursing Registry, located in Boca Raton. I do want to clarify, and I know I've talked about this before, Medicare, along with Medicare supplement plans, also known as Medigap plans, does not cover long-term care. Now, many Americans wrongfully assume that Medicare covers long-term care, making this topic very important because there's a big confusion behind it. So again, Medicare does not cover long-term care. And before I bring my special guest, I also wanted to cover a few questions that I received this week from our listeners. So the first one was, if I go overseas, will my Medicare plan cover me? So Medicare coverage is very limited depending on your plan. I suggest getting travel insurance for the time that you're going to be out of the country. If you want to know if your plan has this limited coverage, my suggestion is to look at the back of the card and give them a call. If I'm your agent, you're welcome to call me and I can, verify this for you and let you know if you have this limited coverage. Now, again, if you're going to be skiing in Switzerland, please make sure do not depend on your Medicare coverage to cover this. Make sure you purchase travel insurance. Do not depend on Medicare, as they don't provide coverage overseas. Second question that I received was, my medication is very costly. What can I do? The first thing that I always suggest is talk with your doctors. Explore generic medication out there. A lot of times there's more than one medication that does the same thing. Speak to your doctor. And aside from this, there are plans that might cover one drug and not cover the other. So look into this. One other thing is contact Social Security. They have a program called Extra Help. And definitely, I've had this happen before, and I say this, go ahead, give them a call. I've had people say, no, Myriam, I don't qualify. And guess what? They qualified. So please give them a call. I know a lot of people are like, oh, I don't want to deal with Social Security. It's not that bad. They're open from 7 o'clock in the morning to 7 o'clock in the evening. So just please give them a call. It's not so bad. Or look them up online. I think you could just do the application online. You don't even have to call them. So look into this if you're struggling to pay your bills. Additionally, I'm going to say this on every show, AEP is coming up. What is AEP? The annual election period. It runs from October 15th through December 7th. This is the time where you make a change. You can drop your plan. You could switch your plan. You can go back to original Medicare if you're on a Medicare Advantage plan. Compare plans. There is a major change happening in 2025, especially with prescription drugs. So please compare your plans during this time. If we are your agents, you can call us directly. Make your appointments early as it gets really busy. You can call us at 561-464-2273. That number again is 561-464-2273. We'll be more than happy to compare these plans for you. If you have any topics or questions that you want me to go over on the show, just please let me know. So I've finished my questions for the week. So without further ado, let's discuss long-term care and welcome Dionne Kellier.
Hello, thank you, Myriam, and happy Saturday.
Thank you. Do you love Saturdays too?
I love Saturdays. One of my favorite days of the week.
Yes. Along with like the Friday nights give me like that vibe too, you know?
Yes. So I know when on Friday nights, I know that my next day, I don't have to do a thing.
Yes. Well, unfortunately, I do still have to get up. My kid, my 5-year-old's like, can we play? But I do enjoy that.
Yes.
You're listening, right, honey? So anyway, tell us a little bit about you.
So my name is Dionne Kellier. I was born in Miami, and I am currently a tax attorney, and I'm also a co-administrator at Caring Nursing Registry.
Okay, so tell us a little bit about Caring Nursing Registry.
Caring Nursing Registry is a family-owned and operated business. We are located in Boca Raton. We've been open since 2005. My mother, who is an RN by trade, she opened an agency in '92, which was a full-scale agency, but Caring Nursing Registry is a home health registry as opposed to an agency. And the difference is that a registry does not offer skilled care. Like, we don't dispense medications and we don't do injections. We don't offer PT. We offer more, companionship, personal care, homemaking, and respite care.
I see. Now, can you tell us a little bit about what is long-term care?
Sure. Long-term care is for people that have chronic illnesses or disabilities and they need medical and non-medical care. They do not have to be elderly. They can be any age. Like right now, our youngest patient is about 34, and they offer personal care such as bathing, dressing, and eating, home delivered meals. They either cook for them or they bring stuff to them. They do grocery shopping for them. They do light cleaning, adult day health care, and supervision, protection, and reminders to take medication, for like if they need help bathing, for instance. They may not necessarily need help with the physical act of bathing, but they may need someone to stand there to make sure they don't fall.
Right. Now, what is the connection between your business, Caring Nursing Registry, and long-term care plans?
We provide services to people who have long-term care plans and also private pay. And as I said, those services include personal care, companion, homemaking, and respite care.
Okay. Now, you did mention, of course, that you guys take long-term care insurance. As we've talked about this in the past, it's very important to have long-term care insurance. But if they don't have long-term care insurance, do you guys take anything else?
We take private pay as well. And so we have different... we have a rate for the week and a rate for the weekend, but the more hours is, the more that we can, the more hours you need is the more we can adjust the rate. And, we are one thing is that this is, a family business, but we've also experienced in our family a lot of people that needed care. And so what we try to provide is we try to allow the family to love their family member. And then we take care of everything else. We take care of the laundry. We take care of, doing the things that you don't really want to, bathe your mom or your dad or your sister or whoever it is, your grandma. You want to just be able to love them and have someone else handle that. And our caregivers, they really have a lot of respect for them because they really they have relationships with the patients and they care about them. And their job is not just a job to them. During COVID, I really discovered how much they didn't even care if their patient had COVID. They just wanted to make sure that they were okay. So we provide caregivers that actually care about what they're doing. And, we just allow the family to love them and the caregivers to take care of them.
Right. Now, we mentioned that your business takes private pay, that you take long-term care insurance. Now, do you guys take Medicaid?
So where the long-term care plans that we take have the Medicaid element to it. So everyone that has a long-term care plan that is older, they also have a Medicaid number. But the long-term care plan is something that they have to pay for. So it's separate from, just a regular Medicaid plan. It's something that they have to contract for. What happened is a lot of people, especially coming from New York, they had the Blue Cross, Blue Shield plans when they were, started working, and it gave them long-term care. And so, now, you get long-term care when you're about 50, and that will allow you to be seen by someone that are an agency like ours. And so we do have the element of Medicaid, but it's not, we don't communicate with Medicaid. We communicate with the insurance company, whether it's Humana or Sunshine Health or, Florida Community Care.
Which is offered through Medicaid. Because you see, there's a lot of facilities out there or home health companies that don't even accept Medicaid at all.
Understood. I understand why.
So that's why I talk about this, because I get this a lot, where there's someone that says, well, we don't have money and, we're trying to get on Medicaid, and what are my options, right? They don't know where to go. And so that's extremely important to know. But okay, so I know you said that the caregivers come out, and do they come to the home?
They come to the home.
Oh,
so
that's wonderful.
Someone could stay in their home and have all of the luxuries of their life. And, sometimes we do like 24-hour care. It just depends on the needs, and it depends on what the plan pays for, which is the biggest issue. Because, I just kind of did the lowest reimbursement plan. If you needed 24-hour care, it pays... for 24 hours, it should pay $468. Most plans pay about $200, $250. So you're definitely not going to get 24-hour care. And the people that have the 24-hour care, it's not in the new plans. It's not in the plans that have been, offered in the past, probably 20 years. It's plans that you probably had since the 90s, early 2000s, and they changed that because it's expensive. And so for families to make that decision to have to they have to, sometimes they have to help, they have to supplement, because people need this care. You cannot leave a patient, so say that the aide leaves at 9 p.m. Right. And, it's like a 12-hour care. So from 9 a.m. to 9 p.m. Then what happens from 9 p.m. to 9 a.m.? Somebody has to, they can't, what if they can't get up and go to the bathroom? Right. Somebody has to be able to turn them, change them, help them so they don't develop bed sores, become hospitalized. Yeah. There's a lot that goes into it, and and we understand that. So that's why we will always work with someone on the numbers, because at the end of the day, we want to provide the care. My grandmother needed care, my grandfather needed care, my aunt needed care. So we understand it from the perspective of we have experienced it.
Right.
Yeah.
Now, I know you mentioned a few of your services. Now, is there any other services? Can you give us a not a list, but just an idea of the main services that you provide? Right.
So, personal care is the actually caring for the patient, whether they are bed bound, whether they need, to be bathed, whether they need to be watched while bathing, whether they are incontinent and they need to be changed, just to make sure that the actual person is clean. And so they don't develop additional sores or anything to, exacerbate whatever issues they have going on. Then homemaking. Homemaking includes light house cleaning. They get, the meals prepared. They'll do grocery shopping for them. They make sure that the house is a livable space. They will, if the aide cooks, which a lot of times the aides cook, and they love the food that the aides cook, and they do, laundry. They take care of the person. And if there's somebody else that lives in the house and they eat as well, the aide is going to clean everything, but the aide is not a housekeeper, right? So that's homemaking. Companionship is just that. You make sure that during the 8 hours that the family has gone to work, that somebody is there to talk to the aide, talk to the patient, keep their mind, here today. There are particular patients that love their aide so much, they don't care if they go into the hospital, they want their aide to come, because a lot of times if they go into the hospital, the insurance will not pay for hospitalization and care. So the family will then kick in on private pay and have the aide go, because they develop a relationship with them. And then respite care is that it provides the family, say they're going out of town, it provides 24-hour care for a short period for the patient. Sometimes it's a longer period. It really depends. Sometimes we have had, respite care provides the most amount of hours because that is to give the family some relief. And sometimes depending on the issues, they need it for more than, a week.
Right.
They need it for 6 months because for the 6 months prior, they have been on the 24-hour care.
Nonstop.
So it allows the family to just get a break, be able to breathe, and then just come in and love their mom, their dad, their, grandma, their whoever the person is.
Be the child or, especially I'm sure it's hard for the child at that point to take care of mom
or the spouse.
Or the spouse. Yeah, that's right.
Because the spouse is typically around the same age.
Right.
So, for us, we get most of our patients that we get are actually referrals. We get them so process-wise, someone has a long-term care plan. They're assigned a case manager, and then the case manager gives them a list of agencies or registries to choose from. And then that's how it works. But if, your brother or sister has a long-term care plan that is kicked in and they're utilizing us, typically they'll refer them to us, and then we, as long as they're in our area, then we're able to see them. And we see husband and wives. We've seen we've had patients that our oldest patient ended up dying when she was 105, but we had been seeing her since she was 95.
Wow.
Yeah.
So. Now, I know you mentioned, thank you for providing us with a list of pretty much the common services, the home health. Now, do you have, aside from seeing them at home, do you have a place where they can go, like a daycare, nothing like that, right?
No, we are a registry. Okay. We do not, we don't have beds. We see people in their homes or if they're in the hospital, but that's the private pay side.
Private pay. Okay, perfect. Now, you did mention temporary, and that kind of popped in my head. Let's say normally the wife takes care of the husband, but she needs that break, right? But it's not constant. It's just that one time. She say, she's going to go visit family. She can call you guys up and hire you for that short term.
Yes.
Right?
Yes. She could call us directly, or the insurance will approve those hours. So they have a process. I don't really know how their process works, but they will approve respite hours. That's what respite is, giving you a break.
Oh, okay. Respite hours. Okay, perfect. Now, I think one important question is, what is your process for hiring caregivers, and how do you decide which caregiver matches with a patient?
Thank you. That's such a good question. So what happens is we have our core caregivers, right? And we know who, and we love them all, and they're all vetted. So they come in and they meet our office coordinator. Her name is Andrea. She's the best. And they bring in all of their certifications, all their insurances and everything, and they meet her, they do their paperwork, and then they take an aptitude test. Okay. I think they have to get an 80% on the aptitude test. They don't even meet me at first. Then my mother interviews them after they pass their test, because my mother, RN by trade, she knows the medical questions to ask them, the scenarios to give them, and she has this sense about this spidey sense that she was they're going to be good, or no, they're not responsible, we can't bring them in. Right. So after they meet my mom and my mom gives the thumbs up, then they meet me, because then I get them into the technology. Because right now, if you are seeing people that have these long-term care plans, we are on this platform. You have to do an EVV clock in. Before it was just written, handwritten notes, but now we make them do the handwritten notes. That's the backup, because you need to have it in the file. But they also have to do a EVV clock in, which is on their phone. So I get them registered into the EVV system. I get them into the system, put all their information in, and then they deal with me from there. They deal with me or the office coordinator from there. And my mother only comes in, to do the intake for the patient. My mother is more, she's the administrator. It's her office, but, we're family business. So we're all a part of it.
Okay. So, that's, now you mentioned, all right, is there if someone would really need an RN, do you have that capability?
So we don't, the only thing that the RN does, because we're a registry, they do the initial assessment. Gotcha. So when my mom does the intake and they're it's okay, well, what have you been diagnosed with? They give us the 4 or 5 things they're diagnosed with. Then the RN goes out and does the actual sign up with them and sees the situation, and then is wait a minute, they probably need more care. Like they are total care, right? Because a lot of times they don't tell us that they're total care. But when they get into the house, they cannot even help. They cannot even assist with being lifted up. So then we're like, okay, well, do they need a Hoya lift? Then we call the case manager. Hey, listen, this person probably needs a little bit more care. So like we are able to, my mother speaks the language. I've learned the language because I do nothing medical. Blood, guts, and trauma. It's not for me. I will talk to you and I'll do everything, but I can't deal with like the ick of it. That's how I describe it. So then after the RN comes back, gives their assessment, then we are able to, okay, this is perfect, or we probably need more. But as far as like an RN providing, giving you dispensing medication, no, we don't do that. That's for an agency.
Got you. Okay. I understand. So that makes sense. The RN comes to the house, does the assessment to see the level of care, so then they match the right person.
Exactly.
Makes total sense. Now, do you check in with the patient and the caregiver once they're matched to see how it's going?
Absolutely. First, we give it, after the first visit, we immediately call the patient, hey, how did you like him or her? Because we have male aides and we have female aides. And then once they say, hey, I love them, it was great. Then about a week later, we'll check in again. And then we do payroll. We still do physical checks. And the reason why I know the aides do not love that we do physical checks is because we want to see them. And I make sure I'm in the office on the Fridays. Payday Friday is actually tomorrow. I make sure I'm there. So, hey, how's everything going? What's going on? Okay. And so I talk to them, always get a pulse. And that's what we do every 2 weeks. They're talking to me. They're seeing me. Some of them love to see me. Some of them really don't love to see me. But I tell them, it's for several reasons. I tell the caregivers, I am your advocate. So you have to tell me what's going on. In case something goes on, I need to know. Don't let the patient call me and tell me that something's happening. You tell me what's going on. Because if you're right, I will fight for you. And if you're wrong, then, you also have to deal with me as well. Because at the end of the day, the patients are in a very vulnerable position. Yes. And you do not want someone taking advantage of them. You see all these stories with caregivers that are, abusing their patients or like that. No, we don't do that here. So that's why everybody needs to be very open. And they love with Andrea. They text her on her personal cell. So anything that's going on, like we have a very open door policy. Tell us what's going on. And the patients, same thing. Have your family call. So the door is always open. So yes, we do a check-in. We make sure that it's matched well. And sometimes it's not matched well.
Right.
And we will make the change immediately.
Okay.
Yeah.
So that's perfect. So that's perfect because you're constantly checking in not only with the patient, but with the caregiver.
Exactly.
To make sure that everything is still working and that they continue to be a match, right?
Exactly.
Now, what are the long-term goals you have for Caring Nursing Registry?
So we want to keep this, as a multi-generational family business. Hopefully my nieces, my nephews, my children, grandchildren, everybody can work there, get the experience. So my mother had an agency in 92. That was the first one she opened, a full-scale agency, went from Dade, Broward, Palm Beach County. I started filing papers. So I've filed papers, I've answered phones, I've done everything, and then now I'm in management. So, people may look and be like, oh, she's, her mother gave this to her. No, my mother did not. I have, since 1992, I have been trying to get to where I'm at in this business. And, now I'm finally here, but I understand how the process works. Yes, I'm not a nurse, but I understand all of the business of the business. And that's very important. And so, with my background, I am a lawyer. I am a tax lawyer. I've done different types of law, but, I want this business to, be able. It teaches you a sense of, responsibility when you are responsible for somebody else's life and not like somebody that you're related to, a stranger that you don't even know. That just gives you a different sense of purpose. And so that's what I really like about it. And I hope that it continues. I hope that, that I'll be able to retire and one of my nieces, nephews, children, grandchildren will take it over.
That's wonderful. Now, can you give us any advice for those people that, they're in their 50s or 60s? Any advice that you can give us?
Absolutely. I tell this to my friends as well. Everybody needs a long-term care plan. And then I feel like it should be supplemented with some other sort of, whole life index universal life plan that provides living benefits, so you can supplement the limits that your long-term care plan has, because you want your family to love you, and someone else whose job it is to take care of you in the event. We're all going to age. We're all going to need somebody to take care of us, and you would have a professional do it. This is their job. They love to do it. People who do this job, they are built for it. You know, they are able to while they are still caring, they are able to take the emotions out of doing the job. Whereas, like, if your daughter, you know, sees your gaping wound, it's not going to be easy for them. Right. So my advice to everyone, when you turn 50, long-term care plan, and when you're younger, if you could get some sort of, you know, other plan that will supplement what the long-term care plan doesn't pay for, then I feel like you should be golden.
That's right. Well, thank you for that. Now, what's the best number to reach out?
Thank you. It is 561-613-6900, and it's Caring with a K, Nursing Registry, Inc. We are located at 1 West Camino Real, Suite 212, Boca Raton, Florida, 33432. It's across from the Fresh Market if you're from around there.
Okay, perfect. So Caring with a K, Nursing Registry. Located in Boca Raton, 561-613-6900. Thank you so much for the education today. You've been wonderful.
Thank you for having me.
Of course. So again, thank you so much for tuning in. If you have any questions or would like to be connected with Caring Nursing Registry, or just have questions, please reach out. You're welcome to call United Insurance Experts, and we'll be more than happy to connect you. So again, our phone number is 561-464-2273. That number again is 561-464-2273. And if you have questions about long-term care, please reach out to us. We'll be more than happy to help you. Have a wonderful Saturday, everyone.
Thanks for listening to Medicare Made Simple with Medicare Myriam right here on Legends 100.3. Medicare Made Simple is brought to you by United Insurance Experts. For more information, call 561-464-CARE. That's 561-464-CARE. Tune in next Saturday at 9 a.m. for more Medicare Made Simple with Medicare Myriam.